All right, Brad, these are 4 muscles. If you have knee pain, you should massage these areas.
We're going to tell them how to massage it too.
We'll do both.
Which muscles, how to do it, everything you need to know. Very good. I'm on board now.
Okay, let's go.
Bob and Brad, the two most famous physical therapists on the internet.
All right, the first muscle, Brad, is a tiny muscle. EDB muscle. You wouldn't think it could give you any pain.
However,
But it does. It actually can flex the knee and actually twist the knee.
and like a lot of small muscles, it's hard to pronounce.
Right.
So we're talking about the Popliteus.
Right. Very good. Popliteus. So to find it, you're just going to take your fingertips, go behind the knee on the inside of the knee.
Yeah, not like this.
Right. The thick portion is on this side. So rub across the fibers, which will be this way, Brad.
I'm doing it right, like that, right?
East to west, right? Yep, that's good.
So there we go. You don't have to stand like I am.
Now, if it's tender, that's a sign that you should do this. If it's not, you'll probably be fine. Go on to the other muscles.
You can still massage it if you want.
Sure. All right, let's go on to the second area.
Number 2.
All right, the second area I want you to consider is some of the hip flexors and the long version, like the rectus femoris, the IT band, the sartorius even.
Now, the sartorius, that's one that's nice to know about.
Right. So you can do this with your hand too, but it's going to be a lot easier with a massage gun.
Right.
And Brad, it just happens we're giving one away this week.
That's right. So sign up for it. It's the EM19. This baby has got some power. It's actually a really good gun for these
very good
large muscle groups.
It's called the EM19, and it's available on Brookstone.com.
Oh, nice.
The giveaway is at bobandbrad.com.
And, if I'm going to do these, you could, here we're working the rectus. And mine's a little sore today because I was doing some biking the last couple days.
Wrecked you, damn near killed you.
Yeah. Whoa, I can feel that. And I might want to work this way. I know it's going to be difficult to see with black on black. Hopefully my hand there
So this is a powerful gun, right?
Oh, yes.
How many speeds, Brad?
This has up to 20.
Wow.
1 through 20. And we want to get the adductors, the muscles in here.
That's another group, huh?
Oh, I'm sorry. I jumped in the
ahead.
gun. We're only on number 2. So that's sartorius.
IT band.
Yep. Right where the white stripe is there is
Right.
exactly where the IT band is. And I can work it there. Just be careful on the IT band to go directly in. It may hurt. There isn't a lot of muscle there, so you may want to go sideways.
You really can't massage it, but it can be bound down. So you can help loosen it.
I mean, you can try to massage it. When you massage these large muscle groups, you need both hands. They are going to get fatigued after a few minutes unless you really have, some really
Strong like bull hands?
Strong like bull hands. Maybe you work with your hands for a living.
All right, let's go on to number 3. All right, Brad, what you already gave us a little preview to is the inner thigh. That could get very sensitive. It could develop trigger points.
Sure.
So you want to hit with the massage gun?
Yeah, boy, I've had adductor strains, and I'm telling you, they're not comfortable.
It often happens if you're not using your glutes right, your glute maximus right.
The buttocks,
Buttock,
the
right.
largest muscle in the body kind of a deal.
And a lot of people aren't.
So I like, you want to get this muscle to relax in this position. I think on a recliner, lift the leg up is a good way to allow it to relax. I like to flip it out so the toe points this direction, and you can get into that muscle. And again, this should feel like a good massage.
Hurts so good.
Yeah, exactly. So, spend a few minutes on that.
We'll go on to number 4, Brad.
Number 4. Oh, that's right.
All right, very simple. Number 4, Brad, is the calf muscle, also known as the gastroc soleus muscle.
Yes. It moves.
Moves.
Moves. That just
And
couldn't-
it crosses the knee joint.
Yep.
So that's why it can give you trouble.
Yep, that gastroc, that's the one that crosses a knee joint. And again, you can work on this manually if you want. You're going
Right.
to get tired hand. It's a large muscle. I always use my thumbs if I do, but my thumbs get tired quickly.
And if it's tight, it will affect your knee.
Oh, yeah. Yeah.
It will cause increased pain.
And this is a muscle, regardless if you have knee pain or not, is a nice one that oftentimes, if you're a walker
Right.
or a runner,
Good for your feet.
yeah, you need to
Good
have.
for plantar fascia.
Because
itis.
this muscle crosses the knee joint,
Right.
connects to the calcaneus, which is directly connected to the plantar fascia
Right.
and the toe extension. So it's one chain.
Really important muscle to keep it loose.
Yeah. Ooh, it's good. That's
All right,
good.
Brad, we can finish up there.
Oh, we're done?
Well,
Yep. All right.
we can fix just about anything.
Except for,
A broken heart.
but we're not going to get it with the gut massage gun.
Right.
No.
So, Brad, by the way, have you broken any hearts?
No, Bob. No, Bob.
The other way around?
Yeah, absolutely.
Me too.
Bob, yeah. Did you notice my hair?
Yeah.
My wife
there.
is concerned about it. She said, "How
Too
can
long?
you go to work like that?" And I said, "Well, I don't know. I'm just gonna go." She wanted me to get it
She
cut
doesn't say
yesterday.
anything about the face.
No, she knows that's hopeless.
Thanks.